SEIU, as we know, the SEIU has been at the forefront of the union battle in this country for public unions, and they've been taking the heat. And it's the SEIU that the Koch brothers and the Republicans are working so fervently to dismantle in Michigan, Ohio, Indiana, and of course Wisconsin, where they've already passed that questionably legal law. So I want to introduce Chip Atkins of the SEIU union.
Hi, I'm Chip Atkins. I'm a social worker with Sonoma County Human Services, and I'm also the member leader of the COPE, which is our Committee on Political Education. I've actually been asked to talk on two topics. One was about the cuts that are being suffered in social services. I can't talk about all social services, but I know well about the cuts in services to seniors. And actually the cuts that are in this budget are potentially deep, you know, as much as 10% in some key programs like adult protective services, sometimes eliminating some programs like adult day health care and a case management program that keeps people out of nursing homes called MSSP. Now, back in 1970 when Medi-Cal was first passed, there was like 5 to 6% of the people over 65 in nursing homes. With programs like in-home support services that provides caregivers in the home, and adult day health care and MSSP, that number has come down to like 3% of the people over 60 are in nursing homes. So it's those programs that service people in their homes that are being cut. There's some that are scheduled for total elimination. In-home support services, which is the mainstay at keeping people in homes, the state pays, in Sonoma County, pays workers $11.50 an hour to take care of the disabled and the elderly so they can stay in their home. Last year they cut the hours across the board 3.5%. This year they're talking about eliminating a whole category of hours that would eliminate people doing housekeeping and shopping for people and just have personal care. And then on top of that, they want to cut 8.4% more of the hours to cut back. And what's going to happen is that people are going to end up going into nursing homes where it's more expensive to take care of them. So that's what's happening in social services. The caseload for in-home support service social workers that assign the hours to people. When I started with the county in '99, the caseworker had about 175 clients. Now they have close to 278 to 300 clients. So it's been a constant cutback, and this is like the biggest cutback we're expected to see ever. Now, I was also asked to talk about unions and what unions do for everybody, not just the union members. Now, we're SEIU, and we're the social workers that take care of people with child protective services and adult protective services. We're the janitors and the cafeteria workers that help keep the schools open. We're the people that keep the parks running. So that's who SEIU is. We're the in-home support caregivers in people's homes, keeping the frail and disabled and elderly at home. Now, you saw in Wisconsin the attacks on public employees. And that's not just on public employees, because we're not the greedy people. We're the people that keeps the institutions working for the whole community. What's really happening is the radical libertarians that believe the only good is the almighty dollar and making profit, and anything that gets in their way is bad. And they're the ones that are attacking public employees because we stand as a progressive force against them. Now, we have not only been fighting for our own pensions and wages, we have a 40-hour work week because of the labor movement. We have child welfare laws because of the union movement. And in solidarity with MoveOn.org we're responsible for the health care reform. So it's important that we stand together, because we're the progressives that are looking and fighting for the middle class, and we stand against those that are fighting for the mega rich.